We understand that it's very dangerous out there right now, and I think like most British Columbians, we're really concerned.
Sunday marks 8 years since the province declared a public health emergency due to the overdose crisis and toxic supply, but more people are dying than ever. Penticton recovery groups attribute the stalling progress on the overdose crisis to gaps in a full continuum of care.
There's lots of phases of getting somebody who's actively using drugs in a harmful way to get them into a state of recovery and sobriety. Some of those involve like detoxification, so the process of withdrawal management and getting them into a stable place where they can actually pursue recovery. And then one of the biggest gaps we find is what do they do at that point? Because housing and safe spaces to live when they are trying to rebuild their lives are in really short supply right now.
The province-wide rate of death for the first 2 months of 2024 was nearly twice the rate recorded in 2016, the year the public health emergency was first declared.
Every year it just seems like everyone just kind of reflects on the people they've lost. We've just got to really try to figure out what that solution is. And I don't think we know what it is quite yet. Obviously, with the statistics, we're not seeing it get any better. So what we're doing is helping. Is it the solution? I'm not sure.
Eyes are on BC's Safe Supply program, which is receiving mounting criticism after the province's Auditor General released 2 independent audits revealing its faults.
I have always said that the Safe Supply program that's been running is not what Safe Supply should be. I feel like there are flaws in it, and I think the flaws are stemmed from the fact that they're not going all in the way that they should. You know, diversion is like a really catchphrase right now. Oh, they're all being diverted. They're not all being diverted. That's not true. But when you offer someone Safe Supply of a medicine that their body is not wired to, and they had the opportunity to potentially trade that or sell it to get what their body is craving, of course that is going to happen.
We don't want anybody to be harmed by the drugs that are out there on the streets right now. The fact of the matter is that there is a lot of toxic drugs out there, but we've also got to realize that there's lots more to it other than just keeping people alive that are using drugs. They need a pathway that's effective.
At the end of the day, the groups note that more needs to be done. For Gasnet News, I'm Casey Richardson.